So I don't have any presentation. It was supposed to be an interactive session, and our colleagues actually were wearing quite official dresses, and they had some preparations with the presentations. I didn't have both, but I would like to have a more interactive session, and I would be glad if you want to take part in my presentation. We would like to hear your experiences as well, and we have a participant from Diyarbakır. So I'm going to share my observations, and especially from the perspective of a psychiatrist in early childhood uh, period. So I suppose I arrived at the earthquake zone on the fourth or fifth day, and I guess I stayed there for 5 or 4 days. I was in Hatay, and during my travel to Hatay, there was a real chaos. The houses were all destroyed and etc. And then we arrived at the Kızılay settlement area in the city center of Hatay, and the regional director of Red Crescent said that, did you see what happened? Because the Antioch and Hatay actually were shaken by the earthquake with the highest magnitude. So there was nothing left from the city. And I said, yes, I saw the city. And he said, no, you didn't see it completely. And he allocated a private car, and they took me a tour within the city. And Antioch and the Hatay, I knew those places. And the panorama, the picture was incredible. And I stayed there for 4 days, and I visited many tents. And during those 4 days, what I was expecting was that I was expecting to see the very early symptoms of severe psychopathology, but I didn't. There was humor on the field, and there were jokes in the air. Children were playing. Of course, there were some technical cases, some of them highly concerning. And I said I have to keep an eye on those patients. But most of the people, those who lost their relatives, their houses were collapsed, and they were living in the tent, but they have a huge resilience potential, especially the children. They can be even more strong in terms of resilience. And I would like to share a couple of factual information about the earthquake as well. In Maraş earthquake, we had the number of deceased people is around 45,000, and after two major earthquake, there were more than 11,000 small earthquakes, small magnitude earthquakes. So why we had a very prolonged time to forget what happened? Because this disaster took a very long time to settle down. So we always had a new trigger. And after the major earthquake, we had the after effects of the earthquake very frequently. So it triggered the trauma. And thousands of people actually internally displaced from their settlement area, and they started to live in another city. So it was a forced migration. 1,025,000 people received psychological support, and according to UNICEF data, more than 7 million children were affected by the earthquake. I don't have any precise definition about the affected. Actually, 2.5 million of children were in Syria, and the rest was in Turkey. I will share a couple of facts, and then I will leave the floor to Berker and to you. So, regarding the earthquake, we've listened to many different presentations in terms of psychosocial support, and all the presentations started with a statement. Everything that we experience, the anxiety, the nightmares, the hopelessness, all of them are the normal reactions that we show to an abnormal situation. It's really good definition, because in the psychopathology, almost all of the psychopathologies are the abnormal reactions to normal situations. So using the lift is a normal situation. Raising your hand and asking for taking the floor is a normal reaction. So talking to your friend, talking to your teacher actually is a normal activity. So if we show an abnormal reaction to those normal situations, so then it is a psychological problem. But if we have an abnormal situation and if you show a different reaction, then it can be considered as normal. We know that the people's reaction under stress conditions are normal, and we waited for some time, but we have a delayed onset concept. After the traumatic event, 6 months later, the delayed onset can start, or it can emerge after years. After Vietnam War, for example, we experienced that delayed onset can emerge, can appear years ago, like 10 years ago. And we have to follow up the cases. And unfortunately, after years, we have the onset of the trauma and we have to deal with the situation. And the earthquake is a natural disaster, and it is nature made, it is not human made, it is a nature made. That's why it is a natural disaster. And the earthquake actually has a more severe cases for psychopathology. Why? Because there are this is an issue that we need to speculate on, we need to discuss, because we have many uncertainties. We have been experiencing a situation that we cannot control. And there is an interesting fact: the death toll is higher in earthquake in comparison with the other natural disasters. And I have a data, I couldn't verify it 100%, but in Afyon, there was an earthquake in 2002. The death toll ratio to injury ratio is 1 in 4. So one people dies, 4 people gets injured. So the another study about Afyon earthquake says that the highest risk for death toll is the uh, damage that the building gets. So if the building is solid, it actually reduces the risk, and also the specific location where you stand during the earthquake also plays a key role for survival. And most of the dead bodies were collected from the um, stairs, for example. So we had a so I had a therapy session with a girl and boy. They are the siblings, and they were studying at the medical faculty and the high school, and they were feeling guilty. And she says, actually, I was sitting on the bed. I actually stood up, but I couldn't move. And their father and mother were running towards them to take them. And her brother escaped towards the gate. And the gate actually collapsed over them. And the girl just frozen on the bed, and she survived. But she was feeling extremely guilty because the other family members were killed by the earthquake. And while actually dealing with the children, so the children is a spectrum, adolescent is a spectrum, and their reactions actually can be quite different than the adults. And the cognitive development level of children can play a very key role in terms of the different reactions they show. For example, their age group 5 to 7, 7 to 12, 12 plus. So their perception levels are completely different than one another. And if they are below 12 years old, they can't have any abstract thinking abilities. But if a child is between 2 to 7 years old, for example, I was in a tent and I was talking to a mother, and I asked her if the child was asking any question about the earthquake. She says yes, the child is asking questions, but I'm just changing the topic and I don't answer properly. And also the children was drawing some paintings, and I told the mother that in this age group, children can personalize the earthquake. They might think that earthquake is a monster living on the ground, living underground, and the child actually painted something, and the child also showed the picture to me. There was a house, and underneath the house there's a monster, and the monster was trying to swallow the whole house. So this is how they have an imagination about the earthquake. And there was a study about the perception of children regarding the natural disasters. The 11 years olds believe that the earthquake happens because there is a kind of gap underground, and it may result in an earthquake. It is not because of the layers of the earth was crashing with each other. So it is not a scientific explanation. And we are also using the debriefing method. Debriefing is also used in the military concept. For example, there's a group of military forces and they will go to an operation, and you can convene them and you can debrief them about the needs and the operation details, etc. So this is called debriefing. They go to the operation and they come back and they again make a debriefing explaining their experiences and observations. And we also have an earthquake debriefing. Let them talk about it. Let them explain their experiences. The only thing you can do is to create a space for them so that they will feel safe and they will explain how they feel, especially on the very early stages aftermath, in the aftermath of the earthquake. The physical safety, physical security, a safe place, and the biological needs to be met, and after that you can provide a psychosocial support. This is the Maslow's needs hierarchy. And I will make a couple of more comments. So what about the time, by the way? Do we have enough time? And when it comes to therapy, um, so those are the mass trauma, and it is not very possible to offer individual interviews, or the group therapies or school centered approaches can be more useful. And I believe that cognitive behavioral therapy is based on a very strong psychoeducation. It is actually a must for the change of the people. It can trigger the motivation, and your internal motivation will trigger a change. And people can actually normalize what they have experienced. They can better understand that this is not a problem just because they are. And this is a kind of normalization process. So, in such traumas, those people can experience those problems because it is the natural outcome of the disaster. If you don't explain this fact to them, they will not be able to normalize the situation. And in the individual therapies, it is important to make it sustainable, but they have experienced a major trauma. So, it is not actually correct that the people can see one therapist one day and another one the other day. So they need to continue seeing the same therapist if it will be an individual therapy session. But during the mass trauma, it is not possible to provide. And therefore, I needed to underline this fact. And regarding the humor and people's making jokes, why do we have humor? Humor is the most functional ego defensive mechanism. It is the most functional one. So our main objective under these circumstances is to protect our ego, our emotional harmony, and it is quite understandable why we are making humor under such stressful conditions. So that's all from my side, and I will leave the microphone to my other colleagues.